Why don't you leave me alone? I'm gonna ride for her and I'm going strong. I'm gonna go from channel to channel. I don't give a damn if you think it's a scandal. I love light skin girl. They make my world out. All I mess with is light skin girl. I'm in love with light skin girl. Avatar. All I mess with is light skin girl. I'm in love with all I mess with the avatar. Yes, I'll buy you a stove. Yes, a refrigerator. Don't care about you haters.
Welcome, everybody. This is D. Durrell with D. Durrell Life Solutions. Happy to be here once again. Very excited about covering this particular topic today. This is going to be about the Lapeef Network. I'm going to be doing a multitude of reviews, at least once or twice a week, on the Lapeef Network because, number one, I love the content. Number two, they do have a licensed therapist on there, Miss Shay, that does talk and say things. She's very opinionated, very intelligent, like the sister a lot. There's a couple of people on there like Antoine and so forth I'm not that fond of, but I do respect his opinion and others, and Lapeef and some other people that get on there and say things, and the other ladies that get on there. So there are some things that I do like about the show. I love more about the show than things I don't like. But I want to talk about a specific topic, okay, per se. We're going to discuss, and I'm going to play the audio of them discussing the limitations, or let's say Antoine and so on having issues, and they're talking about limitations of therapy. They're talking about mental health. And they do discuss this. Now, they talk about relationships all the time. And as you know, I've decided to get into the relationship realm to kind of talk about things from a professional manner. So they're going to talk about relationships. They're going to talk about mental health. And so what I'm going to do today is I'm going to discuss the video in which they discuss these issues and they talk about these things. And we're going to go from there. Now, this particular video itself, you're going to hear the audio. It's going to discuss their position on mental health. Okay? Listen as follows.
At 7, but I'm saying through the beginning of our marriage, maybe when we're reaching that 10-year mark, when things are starting, you know what I mean? Maybe our kids are going through things. Let's do with our family, whatever it is. I feel like if you have a trusted advisor, if you're a spiritual person, that person would also be a spiritual person. But if you align with the right therapist, I really think to me, it's no different. It's the same as my doctor. I've had the same OB for 5 years. I've had the same general doctor for 6 years. All of the same dentist. Like I've been with my people. These are the people that I go to take care of myself and maintain myself. So mental health is also included in that. Like I go every year, get checked. You go twice a year to the dentist. You go once to the OB. You go once to the eye doctor. You go, and all of these are included in your insurance, including mental health. So I think you should check on that regularly, just like you do everything else.
Based on what,
Oh
Chicago?
my goodness. Okay.
Now, let me give a basis. Now, one of the ladies, it's the darker skinned lady. Her name is Kayla Dot. Kayla Ladot, okay? And she just was the person that was speaking first. She's the person that you see on your lower right hand corner. Now, Antoine, and then also Chicago Gorilla are going to talk about why they think that mental health has its limitations that may cause harm. And there are instances in which people who are not professional, people who are not competent, do make mistakes. What I'm going to say is that properly facilitated mental health services do not cause harm. When people improperly facilitate therapy and improperly foster a therapeutic environment or relationship in a mental health services environment can cause harm. I would agree to that, but I want you all to hear this.
How are you gonna say? How can you say?
Cool.
How can you say
cool.
therapy
I know how this
is
gonna
not
go.
good for someone for years?
Now, what Chicago Gorilla stated, because I saw this video live, what he stated was that if you've been in therapy for years, the therapist didn't help you, it didn't work, they're only taking money from you, it's not doing you any good. But see, he wanted to try to generalize something that can't be generalized, because two big things you have to look at. There's two important things. We have to look at the fact that people who seek therapy as a way of correcting short-term issues or long-term issues, who are actually healthy human beings and who are highly functional, versus those who are lowly functional and they have mental health illness and disorders. That's totally different. A person that has a mental illness, like bipolar disorder, personality disorder, anxiety disorder, and they're lowly functioning, they're going to need therapy for years. And some are going to need it for maintenance, as opposed to someone that has an identifiable stressor or issue, which can be resolved, or relationship issues and so forth, that may be resolved in 3 to 6 months or so, or may not involve more intensive care. I am actually surprised that Kay did not clarify that. She failed to clarify that. She spoke more in regards to just trying to say therapy is needed by everybody at some point. It could be beneficial, which I do agree. I would have liked for her to clarify the client themselves, the difference amongst the levels of clients and that level of need or care.
Because I'm basing that on the fact that at some point, if a therapist, not a psychiatrist, those are the two different people, yes?
Psychologist.
Psychiatrist prescribes meds. They're an MD.
Okay, so
See, now Chicago Gorilla just showed his own ignorance in that. He ain't gonna say not a therapist, but a psychiatrist. Psychiatrists prescribe medicine, as Kay stated. Psychiatrists also can be trained in doing therapy, although in the normal population of psychiatrists, they don't. They stick with more of the medical aspects of it, and they refer you to therapists. They don't usually provide the therapy service because it's more financially beneficial for them to assess, diagnose, and prescribe instead of doing 45-minute to an hour therapy sessions. They would prefer you being seen by a psychologist or a counselor.
Things.
ma'am, I'm just
Therapists
making
do
I
like
don't understand. I'm making a
behavioral
distinction that
disorder.
only requires a yes or no. I've made a couple.
Chicago. I
distinctions.
see what's going on. I'm gonna
I've
be
made
easy.
a couple distinctions that
I'm gonna
only
be
require-
easy and let you.
Okay, you can do whatever you want. It's your world. I'm just in it for a minute. But I've made a couple distinctions that only require a yes or no, and I have not gotten a yes
But
or no.
Chicago, you're
What I'm saying
stigmatizing
is,
something.
I stereotype
You are, but you're
saying
saying
in general. I'm not talking about
Chicago,
anomalies.
I'm
I'm not
with
talking
we didn't
about
have
the
to be
few.
these types of clips together. where we're always doing this. All I'm saying is,
But this is why I don't understand. I'm not.
Chicago. See, this is what, in many ways, frustrate me with people who try to argue with professionals about the field that they're in. This is a professional. KA is a professional. Mental health, the field of mental health is the only, besides maybe education, mental health and education, and maybe financial, but mostly mental health are the main two are mental health and education are the two main fields of study in which people think they have the right to give their unsolicited, unprofessional opinion and try to be skeptical about what we do. And some people think they know more than we do. There are people who think they know more than teachers. And the reason why for mental health is because mental health has a cloud under it. There's a lot of fallacies behind mental health because people think normally, everyday person think if you're going to therapy, anything mental health means that you are crazy or insane. And that is not what it means. And that's why people like Chicago Gorilla or Antoine and even Lapeef act the way they do when it comes to therapy and therapists and counselors.
I'm talking about the
Chicago, you're always asking me, what about the young bloods? And now here you are stigmatizing therapy for people. You can be a completely mentally healthy person and benefit from therapy because that's just an objective person.
That is facts. Healthy people go to therapy, and that's one of the reasons why they stay healthy.
You don't have to be in a crisis to benefit from therapy. Chicago, you're wrong. You're literally wrong. We can bring experts on here. No, you're wrong. And I hate the fact
somebody had to be in a trauma to
I hate the fact that me and you have to keep coming here.
No, it's cool.
But Chicago, you're wrong. People who are completely mentally healthy, completely fine, go to therapy. They can go to therapy, and it can benefit them. And the fact that you're here,
I disagree.
Stigmatizing you're wrong though.
No.
He says he disagrees. This is yes, everybody's entitled to their own opinion, but you have no basis for your opinion outside of the fact that you're not comfortable with therapy because of the fallacies and the negativity and the stereotypes about people who do attend therapy. And I understand that you stated before, Chicago Gorilla, that you advocate for therapy. However, if you advocate for therapy, you must understand all aspects of it as involve people who want it. There are people who come to me for therapy one time just as maintenance. There are people who come to me for 3 to 6, particularly those who come to me through the employment assistance program. Then there's those that I've seen for over 3 years. I have people that are severely mentally ill that I've been seeing for over 10 years because they're in a program because they need therapy to function and maintain themselves. There are people who are healthy. There are people who are semi-healthy. There are people who have mental health diagnoses. There are people who are severely mentally ill, where it is no doubt that they're going to need medications. They're going to need therapy for the rest of their life.
All right, we're gonna get Kayla. We're gonna get Kayla.
You're wrong.
We're gonna get Kayla.
No, I'm not literally wrong.
You are.
No,
you don't think.
Okay.
And he refuses to admit he's wrong, which is a disease in YouTube. Nobody wants to admit they're wrong, even when they're speaking to professionals.
Wait, hold on, JR. Wait, hold on. If this is a talk show, if this is a talk show about opinions, how is my opinion wrong? But you're never wrong.
I'll tell you.
Oh, please tell me.
I'll tell you.
Because you're never wrong.
Calm down, bro. I'll tell you. The thing is,
hey man, let me get off this camera real quick.
Leaves whenever what in the world, Chicago? you're wrong. And I'm going to tell you why, because you're literally wrong. You're wrong. People who are mentally healthy, mentally stable, and have
don't do that, Rella.
relationships can still go to therapy and benefit from it. Therefore, you are wrong.
Rilla, hold on. I want to get Kayla. Let me get Kayla in on this. Go ahead, Kayla.
You're wrong.
Hold on, Kay.
Rilla, you're muted.
No, hold on. That's okay. Let me get Kayla in this real quick.
I hate the fact that me and Chicago always have to be the ones.
I can't wait to title. I'm trying to figure out what I'm gonna title this one.
Anton, please don't. I don't.
Go ahead, Kayla.
A notebook. Did you bring out like paper?
Okay, Kay.
So, okay. Whew. Okay, guys. I'm sorry. I just had to. We needed air. Okay. So, in terms of the question, therapy has limits. I thought about it from a different perspective. I think that therapy only works if you're willing and open, right?
She is partially true. She's the lady to the bottom right again, and she's saying that therapy works only if you are open and willing. And I do agree to that to a certain extent. Sometimes court therapy is mandated, and initially people are not open; they are resistant. And then I have to go through therapeutic means to help people stop being resistant and to conform to a sense of understanding that therapy can work and they open up. You do have to have some level of opening up, but initially not all people who attend therapy do so open and willing. So it is correct to a certain extent.
I think in terms of therapy's effectiveness, and I'm talking about therapy, not counseling. So now
this is where she went wrong. And again, Kay did not correct her on this, which to me, I hate to say this, I was very disappointed at Kay in this session, in this particular, even though she was correct. I was very disappointed in the fact that she was not correcting them on their misusage of terminology and the professions that involve mental health. Because she's saying therapy, not counseling, when actually therapy and counseling are used interchangeably. Even though they're somewhat different, those words are used interchangeably. I was trained to understand the differences as it relates to their fundamental meaning. However, they mean the same thing, because when you're doing therapy, you're counseling. When you're counseling, you're utilizing therapeutic techniques and theories. First point, let's talk about the difference. The differences between counseling and therapy is counseling is the act of interacting or intervening with the client, the means in which you communicate, how you communicate, and so forth, the level of questioning, how you facilitate and organize. The therapy side of it is that in counseling, you're implementing therapeutic techniques, methods, and theories. That's what therapy means. But the words are used interchangeably in the field. They are not two totally different things. They actually work with one another. Because when you're counseling, you're supposed to be using therapy means, techniques, different techniques, strategies, theory. Okay? They're used interchangeably because they complement one another. So when someone says not counseling but therapy, no. Kay is a competent professional. She should have corrected her on that. Now, some may say, well, Darrell, you're being a bit, tedious about that. No, it's very important because I believe in psychoeducation. And in psychoeducation, this is the difference between people knowing the difference between a psychologist and a psychiatrist, the difference between someone knowing the difference between a master's level therapist and a psychiatrist. People knowing the difference between a licensed professional counselor and a social worker, or a substance abuse counselor, or a psych nurse, or a nurse's practitioner who specializes in psychiatry, in mental health, as opposed to a psychiatrist. There are differences.
You're talking more psychologists, right? So that type of, I just think the willingness that you have and the openness that you have, that's the limit that your therapy, like that's the limit in terms of how much progress you're going to make in whatever therapy it is. So talking about the effectiveness of the therapy is the perspective I'm coming from. And I think it's only going to be as effective as one, obviously, as talented as your counsel is, but also as willing as you are to be open and be honest and share things and do the work and take on the tools and remember them and write them down or whatever you need to do to take the tools into your real life, right? Now, as far as the argument you guys were having, I do believe that healthy people do get therapy. Like when you're about to get married, you could be the happiest couple ever. We've been together for 2 years, engaged for 1. We're so happy. Things are compatible. You still need to go to premarital counseling. You still need to go to,
Let me stop there. Now, she's stating that healthy people do. She said, use the term need. I'm not going to say someone needs to go to therapy, but I do think that it's beneficial as a form of prevention of issues or just learning more to enhance. You can go to therapy with no problems, but you want to, your goal, let's not use needs, let's say goals. Whatever your goals are. Because some goals are not problematic in nature. But you can go to therapy, say you want to go to premarital therapy. The goal of premarital therapy is for you to evaluate any issues that are going on that may linger into the therapy, into your marriage, or to enhance what you have going on that it can be better once you're married, or to resolve whatever issues you have, or just to understand where you are as a way of just evaluating that, hey, this is what we've been through. I am assessing from the time that we started dating to how we got to this point. It is now validated that this is the person that I want to be with. These are some things that we do have some issues with, little minor things here and there. We can work on that and get through that. Therapy helped us identify that. We're going to move on in our relationship and become stronger and grow through the marriage. But everybody doesn't need therapy. Okay? But if someone chooses to go to therapy, it's what kind of goals they have in mind that will determine that. If you're a healthy person, you don't need to go to therapy, but you may want to go to therapy as a means of enhancing or improving something, or even preventing
those things to prepare for this next step. So I feel like any type of step that you're making in life, and the only thing constant in life is change. Right. So that is why I think therapy, I'm not saying consistently every week at 7 on Thursdays, but I'm saying consistently at some point throughout your life as things change, therapy is beneficial, whether it's you're getting married, whether it's you becoming an empty nester, whether it's you're changing careers, whether it's a parent has passed away. Being in therapy helps you adjust to all these different changes that happen throughout life. So again, like I said, that doesn't mean every Thursday at 7, but I'm saying through the beginning of our marriage, maybe when we're reaching that 10-year mark, when things are starting, you know what I mean? Maybe our kids are going through things, let's do with our family, whatever it is. I feel like if you have a trusted advisor, if you're a spiritual person, that person would also be a spiritual person. But if you align with the right.
Well, let me stop there because I think she's going a little bit too much. It's kind of a little bit redundant and it's a little excessive there. And it's kind of going into all different areas that I choose not to want to get into. But I do think I would have liked to heard more from Antoine or Lapeef or even the lady to your lower left. They basically, well, it's only an 8-minute segment. Island Girl, I think her name is per se. But I think that this particular video signifies the issue with black men not being educated and being open to therapy, and that's the reason why black men suffer from mental illness at the rate that we do, and that's why one of the reasons why we have issues, ongoing issues, as far as black male homelessness, black men being untreated diagnosis, criminality, and suicide. So, I hope that you all enjoyed the video. I wanted to talk about this and touch on this and give my take upon that short segment. I will be doing more videos on the Lapeef Network on reviews. I hope you enjoyed. This is D. Durrell Life Solutions. Have a great day.